Well, I've got a little life hack for you golfers who want to, no pun intended, who want to get out there and have your total hip surgery that your doctor says you're not going to get better without, but come back to golf, the game you love, better than you were when you left it. Is it possible? Well, absolutely. A lot of people will ask us actually, will I be able to play golf after total hip surgery or total hip replacement surgery? And the answer is a definitive yes. In fact, a lot of people have total hip replacement surgery in order to get to play golf again. So for these people, coming back and playing better golf isn't going to be hard because they're actually not even able to play right now. But for people who are kind of playing but having a lot of hip pain, and it gets to the point where a couple shots didn't work and your activities of daily living are starting to be really, really painful, then you're headed for surgery, that's for sure, as long as the x-ray confirms it. And you need to have surgery from a surgeon who's really experienced in minimally invasive approaches like the direct superior approach, the superpath approach, or the anterior approach. And you need to have that surgery in an ambulatory surgery center so that it's safe, doesn't get you an infection, and lets you get up early and walk right away so you don't get blood clots in your legs. But after all that's done and you're home and you're bored out of your mind and you're getting ready to recover, and then the question comes to a lot of people, hey doc, when can I play golf? Well, the answer is right away to some degree. Let's back that up. You can play golf when you can do the physical activities of golf without injuring yourself or causing pain. So when would that be? Well, golf is so many things to so many different people. But when you break it down physically, a lot of the things don't really count. So telling stories about girls you met in high school doesn't really count. Cheating, using the old foot wedge doesn't really count. Misremembering the score or not quite getting it all the things that go with golf, they don't really count. There's only two things that really count. Number one is walking, and number two is swinging the club. Everything else is the fun part. So let's just talk about those two things. Walking is something that you should have been doing within an hour or so of the surgery. You can't walk very far at first, but you get up and walk. You take those first steps, and they're very, very important because that force on the cup is what helps keep it seated properly, encourages the bone to grow into the stem, and seats everything where it needs to be to ensure that you get a great long-term result without any loosening. Walking is really, really important right away, but hey, can I walk enough to really play golf? Most courses are 5,000 to 7,000 feet. 5,000 to 7,000 yards. That means they're around 10,000 steps, the number that we throw out a lot as the right number of total steps to get per day. It really comes down to about 3 to 4 miles. So in order for you to be able to walk your favorite golf course, you got to be able to walk, and that's about 3 to 4 miles. So get out right after you have surgery and start walking. First day, try to walk around the living room. Second day, to the mailbox. Third day, try to get out around the block. Walk in a circular pattern. You don't want to walk all the way out and you can't get all the way back, right? So walk where your house is kind of in the middle of where you're walking. Do some laps. In other words, don't go on a little journey to nowhere. And then once you can get up to about an hour of walking, you're at about 2 miles. Most people walk about half a mile per hour. So once you can walk for about an hour, you're at 2 miles. If you can walk for 2.5 hours, you're at 3 miles. Plenty of walking to play golf. When's that going to be? You tell me. It's whenever you get comfortable and you get there. One good kind of rule of thumb is to try to double your walking every week. So if the end of the first week you're walking for about 10 minutes and you've ditched the walker and things are feeling good, the next week try to go for a 20-minute walk. The question sometimes comes up, does that mean 20 minutes if I walk 1 minute 20 times a day? Is that 20 minutes? No. You got to get on some tennis shoes, go out and walk for 20 minutes or 30 minutes or 40. But double it every week. And so, before you know it, you're going to be walking a good distance and give yourself a good chance. Well, not once you're able to walk 2.5 miles, but as you're getting out and as you're feeling better and better, as soon as you're ready, it's time to start practicing your swing. And this is the hack. This is the part where if you do this, you're going to come back to golf better than you were when you left it.